Okay, yeah, what?
Okay, so one of the things that we have all of our patients do is take Actigall post-op. Actigall is a medicine which is also called ursodiol, and Ursa comes from Ursa the bear, like Ursa Major. And it's actually a chemical which is from the bile of a bear. So it's bear bile. And the reason is that when you hibernate and lose weight, the risk is that when humans do that, the bile gets thick, it can form sludge and actually form stones and gallstones. That happens no matter how you lose the weight. So if you lose weight by going on Jenny Craig or a diet or something like that, you can get sludge and gallstones and then have to have emergency gallbladder surgery. That's what we thought thought you were having. Now it turns out bears hibernate every winter and they don't get anything to eat and they burn their fat, and so it would be a challenge to get a gallbladder surgeon for a bear in the winter. So they have developed their own bile that's less likely to form stones. So we feed you, our patients, bear bile so that you have a lower risk of developing gallstones. Now, it still can be kind of hard on your stomach because it's bile, so we recommend that you don't urgently start to take it right after the surgery because it can upset your stomach, and start it about 2 weeks post-op.
Why do you suggest it if you don't have a gallbladder?
Really good question. So I'm going to repeat your question in case it didn't get on the video. Why, Dr. Rutledge, do you recommend it even if you don't have a gallbladder? And you didn't see it, but right before we started, a very thin woman came up and said hi to me, and I did not recognize who she was. She says, I want to say thank you, you're wonderful, you did my surgery last year, and I was, kind of, women come up to me all the time like that. Just kidding, I'm trying to get on the Jimmy Kimmel show. And she said, oh, and by the way, my pancreatitis is getting better. Now we have to do a little bit of anatomy for you and explain that the liver, the gallbladder, the bile duct, and the pancreas are all connected to the upper gut just beyond the stomach. So that when you eat fatty food like fried chicken, the stomach works on that greasy food initially and then squirts it into the beginnings of the gut, the first part of the small bowel called the duodenum. And as it gets squirted in there, bile comes out of the liver, out of the gallbladder, down the bile duct, and into the duodenum, the first part of the bowel. And right next to it, and sometimes in the same tube, the pancreas secretes pancreatic enzymes that again help you digest fats and carbohydrates. But all of these things are working through these fairly fine caliber tubes. As you talked about, you can get stones in the gallbladder, and that's the most common place to find stones, especially if you lose weight. But you can also get sludge or stones in those little tubes. If you get sludge or stones in the tube coming out of the liver, those are called common bile duct stones, and they can cause crampy pain and abnormal liver function tests and problems with your liver and jaundice and pain that's very severe. But you can also get stones that block up the pancreas and sludge and gunk, and that can cause pancreatitis. So just this morning, we had a woman who's one of the handful who's had pancreatitis after this surgery. Probably because she wasn't taking the Actigall. And so some sludge plugged up the pancreatic tube, the duct that comes out of the pancreas, and we don't like that. In the past, I would say don't take Actigall if your gallbladder's out, because you don't have to worry about gallbladder stones. But when you get these funny episodes of pancreatitis or liver disease or funny pains that can't be diagnosed, frequently it's hard for the doctor to figure out, and the patient may undergo a lot of tests, including sometimes dangerous surgery and dangerous tests. So having had experience with that, we basically say, I think it's better for everybody to just take the Actigall.
How long?
The idea there is that as long as you're losing weight, that bile can be abnormal. So we recommend, as a rule of thumb, you take it until your weight loss has started to stabilize and you're losing less than 5 to 10 pounds a month. If you can, those of you who are watching this video, if you come to this video because you've got some funny abdominal pain after the MGB, first of all, call me. First of all, remember that the most likely thing is an ulcer. But if you've got funny abdominal pain, we see that sometimes in cases where patients have sludge or gunk which has built up either in the liver duct, the common bile duct, the gallbladder, or the pancreatic duct. And so call me, and maybe a therapy might be to restart that Actigall. And if you want to, you can take this video to your doctor on your little iPad or iPod Nano and show him this video. The woman who was just here who had pancreatitis cut out a section of the manual and showed it to the doctors after they couldn't figure out what was wrong, and then they said, oh, maybe that's it. So sometimes we can be helpful. So
I took my manual with me. I took both of them.